Uganda has reportedly turned to gene therapy as a way to curb the rapid spread of HIV and sickle cell in the country. Gene therapy is a technique that uses genes to treat or prevent disease by addressing the underlying genetic cause. It aims to modify or replace faulty genes with healthy copies or to introduce new genes to correct a genetic problem. In Uganda, the Joint Clinical Research Center is at the forefront of learning this technology.
We have systematic follow-up of clinical trials that we do. We go from phase 1, phase 2, phase 3, and right now we are at the level of phase 1. When should we expect to have a product in the public sector? Will depend on when we start. We have not even started phase 1 trials here, and there are many different products that are coming out, that are being developed. So I think actually what we need to do is to start now. If we want to get any product in the public sector to give to our patients, we need to start the research now, because the research takes time. It's a process.
Uganda, in collaboration with other countries, is keeping an ear out for how to better use this technology to treat deadly viral diseases in the country.
STIOP under the pathogen economy, we've worked on vaccines that we are now taking into the clinical trials. We've worked on drugs. So that support at STIOP is able to support research and development, and that's how we shall be able to get out of the laboratories and get onto the market. But this takes standardization.
The country, via the Uganda National Council for Science and Technology, has made guidelines that health centers must follow if they are to use this advanced technology method of curing HIV.
So no research work will go on gene therapy in Uganda without regulatory approvals. And so that is why the regulatory bodies are very much involved in what we plan to do, and so that they are prepared and ready to review our proposals and also monitor. First of all, to understand what gene therapy is, to review our proposals, and then monitor the work as we do it, to protect also participants and in terms of safety.
We have developed the gene editing guidelines. The gene editing guidelines is actually the core document that guides the new technologies such as gene therapy. That guideline has been thoroughly developed. We have had input from our lawyers, and also we have discussed briefly with African Union, and what we have now been told to do is to make sure that we submit it to the Biosafety Clearinghouse under United Nations Convention for Biological Diversity.